Prior to performing laser hair removal treatment, ensure that medical history has been reviewed, treatment consent has been signed, and patient does not have any contraindications to treatment. Review pre- and post-care instructions and answer any questions the patient may have. The treatment area should be closely shaved and hair-free. Remove any lotions or residue from the skin and ensure treatment area is clean and dry. You are now ready to begin treatment. Begin by assessing the treatment area to determine Fitzpatrick skin type, level of suntan, hair color, and hair thickness. Select the wavelength that you would like to utilize for treatment. This can be done by pressing and holding the circle in the center of the screen labeled Alex or YAG. Alexandrite 755 nanometers is ideal for treating lighter Fitzpatrick skin types, and ND YAG should be utilized when treating Fitzpatrick skin types 5 and 6. Ensure you have selected the spot size that you wish to use for treatment. This will be highlighted on the bottom left corner of the screen. Press the application drop-down menu and input patient hair removal parameters. Select hair color, hair thickness, Fitzpatrick skin type, and level of suntan. The device will give you recommended parameters. You may perform test spots at the recommended settings, adjusting parameters until you reach a clinical endpoint of perifollicular edema or erythema. Remember that pulse durations should match the thickness of the hair. Thick hair should be treated at 10 milliseconds. Thin hair should be treated at 3 milliseconds. And finer, more resistant hair can be treated at a 2 millisecond pulse duration. If you reach the maximum fluence offered on the spot size being used, but haven't achieved clinical endpoint, you may switch to a smaller spot size and increase fluence. Continue to perform test spots to reach clinical endpoint. When treating large areas, consider using a white eyeliner pencil to mark the skin and break the treatment area into smaller sections. The distance gauge should be flat, flush, and perpendicular to the skin. Overlap should be 20 to 30%, similar to that of the Olympic rings. Repetition rates range from a single pulse up to 3 Hz. When treating at faster repetition rates, use caution to ensure good treatment technique. Every 50 pulses, the distance gauge should be wiped clean to prevent debris buildup. This can be done with moistened white gauze. Once the treatment is complete, apply cool compresses to the treatment area. Topical cortisone may be considered at physician's discretion. Sunscreen should be applied to the treatment areas that will be exposed to the sun. Review pre- and post-care instructions with the patient.